Hello everyone, welcome to RAAONLINE. I'm Dr. Abhinaya. I'm a consultant pediatrician. So we are in the chapter discussion of neonatology, and now I'm going to discuss on hypoxic ischemic encephalopathy. So there are many theory questions as I went through the last 10 years papers. Many theory questions on so how do you manage a newborn with hypoxic ischemic encephalopathy, and especially on therapeutic hypothermia. There has been separate 10 marks on therapeutic hypothermia also, and the overall management of HAE newborn is also asked. So let's start with the prevalence of neonatal encephalopathy. So encephalopathy is a broad term. We are going to discuss only on the HAE insult, that is hypoxic ischemic insult. So the most common cause of encephalopathy will be a hypoxic ischemic insult. More than 95% are due to the perinatal events. 3% are non-hypoxic ischemic and only 1% is due to a prenatal insult. So perinatal asphyxia is a major cause of under 5 and neonatal mortality, particularly in developing countries. So neonatal and under 5 mortality. So the latest estimates have mentioned that around 9.4% of the total under 5 mortality worldwide is due to an perinatal asphyxia. And apart from, so perinatal asphyxia is one, prematurity and infections. These are the three most common causes of neonatal deaths, and any prenatal insult is also a very important cause for stillbirth. So coming to the incidence, so this is given in the Nelson textbook. This is as per the NNPD, that is National Neonatal Perinatal Database 2002-2003. So this is roughly for you to understand, that is the incidence of severe perinatal asphyxia. 8.4% of all live births had an Apgar score of less than 7. So this is roughly, you have to remember the incidence. Among these newborns who were born with perinatal asphyxia, the most common resuscitative measure that was used was oxygen, followed by bag and mask, that is positive pressure ventilation 6%, chest compressions only in 0.8%, and medicines were used in 0.5%. So oxygen was the most commonly used resuscitative measure. So coming to the etiology. So the etiologies we can divide as maternal causes and newborn causes, or the fetal causes. Maternal causes broadly, you have to remember that any etiology or any disorder that causes inadequate oxygenation, so any placentation issues, or maternal blood pressure is low, or if there was a preterm labor and premature separation of the placenta. So anything which is impeding the normal blood circulation from the placenta is going to cause a perinatal or a prenatal insult. So inadequate oxygenation from the maternal blood, maybe the mother had a general anesthesia, there was a cyanotic heart disease, respiratory failures, etc. And low maternal blood pressure due to an acute blood loss like a placental abruption or a bleeding placenta previa, inadequate relaxation of the uterus because of preterm labor, uterine tetany, etc., or premature separation of the placenta, or because of umbilical cord prolapse. Also certain maternal diseases like diabetes, PIH, maternal infections, etc. So during the process, perinatal, if the causes pertaining to the fetus, so the baby has a cyanotic congenital heart disease, a severe pulmonary disease which is impeding the oxygenation, severe anemia in the newborn, or shock maybe due to a overwhelming sepsis, massive blood loss, etc., or a drug-induced suppression, or because of a CNS injury, the transition or the baby has failed to initiate its first breath.